Hello, everyone, and welcome to this FIP digital event. Good morning, good evening, good afternoon to wherever you're joining us from, and welcome to those joining us live and to those who will be listening afterwards to this webinar. I'm very pleased to welcome you to today's event, Enabling Life Course Immunization through Pharmacy-Based Vaccination, where we're also launching a new FIP policy toolkit. This event is part of the wider FIP program, enabling equity, access, and sustainability of life course immunization through pharmacy. Thank you so much, and looking forward to hosting this event with my colleague Noor. I'm Lina, the FIP lead for Equity, Sustainability, Policy, and Development. My colleague Noor Al-Tahla is with us today. She's the project coordinator for Equity, Sustainability, Policy, and Development at FIP. Thank you, Noor. Before we begin, I'd like to go through the usual housekeeping announcements. Just to confirm to you that this webinar is being recorded and live streamed via YouTube. The recording will be available on our website, events.fip.org. You may use the question box provided in the Zoom panel to ask any questions throughout the webinar. You are, of course, more than welcome to provide feedback on our event to webinars@fip.org. And if you aren't already, please check out our membership benefits and consider becoming an individual member of FIP. Thank you. I want to also start by a quick acknowledgement to Pfizer, who are sponsoring this webinar through unconditional funding. What we're doing today, we have quite a packed agenda. So we'll start by a quick summary of FIP's highlights and work on vaccination, especially relevant to the issue at hand today, focusing on life course immunization. We will also provide you with an overview of the program on life course immunization, which I mentioned earlier. We are, of course, excitedly going to launch our new policy enabler toolkit. As part of the launch, we'll be hearing from 4 colleagues across Australia, Lebanon, USA, and Portugal on enablers and barriers in their own countries to achieve life course immunization through pharmacy. These country case studies are also highlighted in the policy toolkit, so we're very excited to have a deep dive through live presentations from our speakers today. We will also very briefly summarize to you the key enablers and barriers to life course immunization, which form the crux of the toolkit we're launching today. We also have a plenary from Daphne Holt, the chair of the Coalition of Life Course Immunization. Supporting us with delivering the program is our FIP CEO, Dr. Catherine Duggan, who's with us today. Thank you so much, Catherine, for joining today. Hi, Catherine. Good to see you on camera. From Portugal, we have Luís Miguel Lourenço, who is the FIP Professional Secretary. He holds many other affiliations, as you can see on screen, and we're very excited to hear from him a bit later today on Portugal and the key issues, challenges, but also enablers for vaccination there. Thank you so much, Luís, for joining today. I'm very pleased to also present Faye Sim. She's the National President of the Pharmaceutical Society of Australia, joining us from Sydney. Hi, Faye, and thank you so much for joining us today. We look forward to hearing from you shortly. From the US, we are joined by Sarah Sorum. She is the Executive Vice President and CEO of Pharmacy Society of Wisconsin. Thank you so much, Sarah, for joining us. I know it's super early for you. Thank you so much for being with us today. Luna from Lebanon, Luna Bijri, who represents the Lebanese Order of Pharmacists, but she's also a community pharmacist. She won't be able to join us live today, but she has been kind enough to send us a pre-recording of her presentation, which will be part of the live event today. And last but not least, we are joined by Dr. Daphne Holt, the chair of the Coalition for Life Course Immunization, who is joining us from France. Thank you so much, Daphne, for joining us today. We'll hear from our esteemed speakers soon. And just to save time, we will be sharing their full bios on the chat, just to give time for them to focus on their content and presentation. I'm going to invite my colleague Noor to give us a very brief overview of FIP's work on vaccination and how it's leading to where we are today. Thank you, Noor.
Thank you so much, Lena, and thank you to all our esteemed panelists for joining us today. Hello, everyone. As Lena mentioned, we'd like to provide you with a very short summary of some of the work that FIP has been doing on vaccination. And as we all know, prevention is better than cure, and we know that vaccination is the second most effective public health intervention after clean water. So our work on vaccination is based on the conviction that improving vaccination coverage and promoting a life course approach to vaccination are global imperatives to which pharmacists can greatly contribute. Over recent years, FIP has grown both our advocacy and policy efforts to expand the role of pharmacists related to vaccination promotion and administration and at global, regional, and national levels. Of the 21 FIP development goals launched in September 2020, vaccination is linked to 17 goals, which clearly indicates the high priority vaccination holds not only for pharmacy and FIP, but also for global health. In particular, Development Goal 16, focusing on communicable diseases, is overtly linked to the prevention of this group of diseases, in which vaccination plays a prominent role. FIP's disease prevention program aims to advance the role of pharmacists in the area of disease prevention strategies that enable us to remain healthy, functional, and productive, leading to happier lives, stronger economic growth, and less pressure on health systems. Pharmacists can have roles in healthier promotion and literacy, in self-care, in management of self-limiting conditions, vaccination, and prevention of communicable and vector-borne diseases. A key element of the prevention program is the role of pharmacists in improving vaccination coverage rates throughout the life course. You can find out more about this program, the prevention program, on our website, prevention.fip.org. So a very quick overview of our work in the past few years. So our vaccination work spans more than a decade, marked in 2011 with the joint WHO-FIP Good Pharmacy Practice Guidelines, where the administration of medicines, vaccines, and other injectables is defined as a key role for pharmacists. Prior to that, FIP focused on observing and understanding vaccination trends through our member organizations. The 2011 milestone report was followed by a number of other key global reports, toolkits, as well as a 2018 summit on advocating for pharmacists' role in vaccination. In 2020, we saw the launch of the FIP development goals, including Goal 16, communicable diseases, which further cements the role of pharmacists in disease prevention. That year also saw the launch of global reports, calls to action, and advocacy tools to support our members worldwide. In the same year, FIP launched the first digital program, Transforming Vaccination Globally and Regionally, that addressed the essential role pharmacists play in saving the lives of millions through the provision of vaccines. This program built on the decade of work FIP has led in vaccination, but with a particular urgency given the pandemic we had found ourselves in. So in 2021, FIP also published several other publications, including toolkits and handbooks to support pharmacists and pharmacy-based vaccination. In addition, FIP launched the second digital program, Transforming Vaccination Globally and Regionally, that included a series of digital events, a commitment to action, a collection on transforming vaccination through pharmacy, as well as a call to action to transform vaccination. And last year, in 2022, several other publications were also published on vaccination with a focus on COVID-19. So other publications address pharmacy education on vaccination, vaccine hesitancy and complacency, as well as regional challenges and enablers of pharmacy-based vaccination. So this was a very, very quick overview of what we've done over the past few years, but you can find out more on our website, fip.org, and on our microsite, prevention.fip.org. And now I'd like to introduce our CEO, Catherine Duggan, who will tell us more about the latest FIP series on life course immunization. Catherine, the floor is yours.
Thanks so much, Noor. and an absolute pleasure to be with everyone here today and to be speaking about the programme specifically. Next slide, please. So the FIP series, Enabling Equity, Access and Sustainability of Life Course Immunisation through Pharmacy-Based Vaccination, builds on the lessons learnt in the previous programmes. Each programme informs the design of the next and builds and takes us forward. And those programmes, as Noor has mentioned, were the Transforming Vaccination 2020 and 2021 programmes. Next slide, please. Learning from the work we've delivered, we have identified the key points that influence the next steps and take us forward. They really include equity and access to the COVID-19s, but are not solely focused on COVID-19 and also considers other vaccines at various stages of life. FIP aims to address how we can mobilise our pharmacy workforce to meet the pandemic iceberg of need and change the system to provide sustainable services across the year. Those key points include defining equity is not possible without inclusion of all members of society of all ages. Next, whatever happens through an infant's life will affect their health later in life, as well as the health of those around them. Next, inequities are cumulative with an impact on the health of a whole population and generation after generation. Next, the importance of a political will to set policies in place to make the changes required to achieve equity. And then different communication strategies should be used to reach out to different generations. Next slide, team. These are the programme deliverables. The programme focuses on sustainability, equity and access, and thinking through life course immunisation across the calendar year. It includes a suite of advocacy activities and events and publications. FIP delivered the first event of the series during the Congress in Seville in Spain last September, as well as 3 digital events that focus on accelerating policy in support of pharmacy vaccinators, with the intended audience being senior leaders of pharmacy association and policymakers, really mobilising the profession in the nations. As part of the programme, FIP plans to launch 2 evidence-based publications. One is the Enabler policy toolkit that captures the outcomes of the events and builds on FIP's advocacy toolkit and all the advocacy that we delivered in 2020 and 2021. This is the toolkit we're launching today, a one-stop shop that pulls together all the updated developments that we have. The other publication is one on pandemic preparedness and the response of pharmacy globally, regionally and nationally, and that will be launched next month, August 2023. This programme also aims to deliver advocacy activities, including commitments and calls to action to enable and support policy for pharmacy-delivered life course immunisation. Next slide, team. The 3 digital events that took place over the past few months have helped shape the toolkit that we're launching today and have provided, as ever, with valuable insights and some key policy barriers and enablers from different countries around the world. The first event focused on remuneration of pharmacy vaccinations as one of the key policy enablers of pharmacy-based vaccinations and therefore life course immunisation. The FIP data shows that remuneration models vary widely across the countries and between the regions, and hence understanding the different models and country experiences is key to wider implementations. Experts from Finland, Greece, Jordan, South Africa, Portugal and Ireland joined and shared their remuneration models and journeys for the benefit of policy enablement everywhere. We're seeking to find case study after case study so that we can build the metric around how to remunerate for such services. The second event in the series focused on the regulations of pharmacy practice as a critical determinant of pharmacists' authority to administer and/or prescribe vaccines. Vaccine regulations and prescribing also vary among the different countries and between the regions. And during this event, experts joined us from Spain, Norway, Australia, Lebanon, Sierra Leone. Each colleague described how pharmacy-based vaccination, including prescribing, is regulated in their countries. Again, building a picture of the variation, but also models for other countries to learn from and share. The third event in the series focused on access to data and vaccination records. And here we featured pharmacy leadership bodies from across the world to explain their progress with access to records and how this impacts access to vaccination through pharmacies. This issue is not solely focused on vaccinations. We know that shared records or access to records is hugely important for other elements of pharmacy practice, but we started with vaccination in this series. These countries include Canada, the US, Costa Rica, Portugal, and Saudi Arabia. So to today, we're really pleased to announce the launch of this policy enabler toolkit. It's part of this programme on life course immunisation. And as with all FIP publications, we will revisit this over time to update and build. The toolkit, supporting life course immunisation through pharmacy-based vaccination, enabling equity, access and sustainability, outlines the 3 policy areas that need to be addressed: regulations and prescribing, service remuneration, access to data and vaccination records. For each area, case studies from different countries are presented, along with the enablers and barriers that they experienced. Now it gives me great pleasure to hand back to Lena, who will take you through the contents of the toolkit. Thank you very much.
Thank you very much, Catherine. And such a memorable moment following months and months of hard work. I've just shared the link to the toolkit in the chat box, so inviting you all to read through it, explore that, get back to us with any thoughts and suggestions. This will by no means be the last piece of this of work on this issue, but only the beginning. So very briefly from me, but really what we're doing today is try to liven up the content. So we have obviously the toolkit, includes an introduction. So a lot of it is content you've just heard, and we will have a small video presentation from our FIP colleague Gonzalo, who's doing a video summary of the introduction for you. So we'll play that in a moment. But as Catherine just mentioned, the 3 areas we focused on are regulations and prescribing, service remuneration models, and access to data and vaccination records. We believe at FIP that these are some of the 3 most important policy areas that either enable or present a challenge to life course immunization in pharmacy. Of course, there are many others, but this was the focus of the program. So for each of these areas, we have a chapter that presents country models, and then what we've done is analyzed all of the data from the country models and derived a list of key policy enablers and barriers across each. These can be used as a tool for members to map where they are, what the barriers they have presented in their country, what have they ticked off from the enablers, and and what they can prioritize in terms of progression and next steps for transformation. So what we'll do today is also hear from at least 1 country case study covering each of these areas, and then summarize the key policy enablers as well. So without further ado, I'd like us to delve into the content, hear from the contributors directly. So without further ado, I'm welcoming the video of our colleague Gonzalo Sousa Pinto, who will be doing a brief summary of the toolkit. What I'll be doing is also inserting his bio into the chat. Noor, we're ready for Gonzo.
Hello, my name is Gonzalo Sousa Pinto, and I'm the FIP lead for practice development and transformation. Health equity is achieved when all individuals, regardless of age or group, have equal access to quality healthcare. Inequities in healthcare have cumulative effects, impacting people's lives for years and affecting those around them. Vaccination plays a crucial role in preventing diseases and complications, particularly in vulnerable groups such as those with chronic long-term conditions, pregnant individuals, and older adults. The concept of life course vaccination emphasizes the importance of vaccination throughout life, not just childhood. This approach calls for expanding vaccine accessibility beyond healthcare centers, with community pharmacies playing a key role. Pharmacies' presence in communities allows for convenient access to vaccines, especially for working adults and older individuals. Bringing vaccination services closer to people can increase vaccine uptake and reduce the spread of disease. Pharmacists, being part of the community, can build trust and communication with patients of all ages. They can address concerns and provide customized information about vaccines to different age groups, improving health literacy and addressing vaccine hesitancy. For that reason, promoting health equity and implementing life course of vaccination with the involvement of community pharmacies and pharmacists can lead to better health outcomes for everyone. The International Pharmaceutical Federation, FIP, supports improving vaccination coverage and adopting a life course approach to vaccination through highlighting the vital global goals that pharmacists can significantly contribute to. FIP has linked vaccination services to 17 of its 21 development goals, highlighting the high priority in vaccination in global health. FIP is committed to promoting life course immunization through pharmacies, recognizing the interconnectedness of equity, access to medicines, and sustainability in pharmacy. By advocating for integration of pharmacy-based vaccination services throughout life, FIP aims to improve global immunization coverage and ensure timely and appropriate vaccinations for all individuals of all ages. FIP is part of the Immunization for All Ages initiative, or IFAA, which advocates life course vaccination globally and locally, seeking support from policymakers, NGOs, governments, healthcare providers, and citizens to prioritize vaccinations for all stages of life. The IFAA manifesto outlines 3 areas where pharmacists can contribute to vaccination strategies: prioritizing prevention, ensuring access for all, and reducing inequity in access to vaccination. FIP has published various resources and toolkits to support its member organizations in expanding the roles of pharmacists in increasing vaccination coverage. This includes guidance on advocacy strategies, implementation of pharmacy-based vaccination services, and case studies from different countries. FIP has also worked on various aspects of vaccination, including regulations and practice standards, building vaccine confidence, and workforce development. It has also delivered programs to transform vaccination services through pharmacists, to share experiences from different regions and identify key points that influence immunization throughout life. FIP will continue its efforts and focus on enabling equity, access, and sustainability of life course immunization through pharmacy-based vaccination as a step closer to improving global health. Thank you.
Thank you so much to Gonzo on behalf of the team, and I'd like to thank him. He's the FIP lead for practice development transformation and contributed to the report. I'd also like to thank our colleague Ruben Vega, FIP practice development transformation projects coordinator. Both of them have been invaluable in contributing to the work of the program and the policy toolkit. So thank you so much. And without further ado, I'd like to invite our first speaker, Luís Lourenço from Portugal. Again, he's the FIP professional secretary, but holds many leadership positions in Portugal. So he's here in both capacities, I suppose. Luís, thank you so much for joining us, and I open the floor.
Thank you so much, Linda, for your words, and thank you so much, FIP, for the kind invitation to once again to share some of my experience in vaccination in Portugal. Well, I have a very short presentation because for the sake of time, we have a lot of panelists also joining, but I'll try to have an overview of what has been the vaccination history in Portugal. Some of the participants come from jurisdictions when it is possible to vaccinate, others come from jurisdictions when it is not possible. Probably some of the information will not be that relevant for your own experience, but I'll try to cover as many aspects as possible. Anyway, feel free to write down on the Q&A box any questions you might have. I can answer them afterwards. And as Lina has mentioned, mentioned, I'm here with different hats. I'm first and foremost a community pharmacist. I've been serving on FIP for a couple of years now. I'm holding now the position of professional secretary, but I've been also working at the society as a regulator of the pharmacy profession in Portugal, which is something relevant, as you can see. I will be able to see in next couple of slides. So if you move to the next slide, we'll see actually how the process was established in Portugal. There was a change on the legislation, and this is a very important point because, as you know, pharmacies and pharmacists are highly regulated from their practice, but there was a change on the regulation back in 2005, allowing pharmacists to actually vaccinate for vaccines were out of the national vaccines program. So the national vaccines program is actually provided by our National Health Service, but all the other vaccines, namely, for instance, the flu vaccine, which actually was one of the most administered in community pharmacies. Of course, that the premises had to be adapted in community pharmacy to actually be able to hold this service, and the society at the time also established the standards for which the pharmacists had to go through. Well, not the standards, the education and the training that pharmacists had to go through in order to have the competency to administer the vaccine. That it comprises of two major areas. First of all, related with the administration itself, and the other part has to do with life support. As you know, you might have some side events of the administration. As also another side note, there's been no serious side event registered in Portugal for the last 16 years that we are running the service, so it's very good news. But anyway, we do have the training, which has to be renewed in a couple of years, both the part of the administration and also for the life support. So this is very important, the idea that the society as a regulator just sets its standards, which is important for the population and also for the regulators. Also, probably that's something out of all of this, but sometimes vaccination can be the starting point of administrating other injectables. And we can see that now in Portugal, that we have now the opportunity to inject muscle relaxants, anti-inflammatory drugs, antibiotics, cortisones. This is a very important point from the political point of view, but as you know, innovation has been on medicine has been very much on injectables. So it's important to have that ability and skill within our premises. On our next slide, you will see actually an overview of the reimbursement systems that we have. And we have different systems, and they are also chronological, meaning that the first one that was the first one established back in 2007, in which, while you had to go to your GP practice, you had to ask for a prescription, then you go to the pharmacy, then National Health Service will reimburse the vaccine, but you had to get your own money to pay for the administration. There is no standard money amount for this. It's based on the pharmacy that you're actually having the service. But anyway, this idea that the reimbursement was only on the vaccine and not on the vaccination service. But that was the first step, because we see that in a lot of partner entities, namely big corporations, big even public institutions, they saw the value of having pharmacies vaccinating especially for flu. So what happened is that there was establishment of a couple of partnerships in which those partner entities would actually would take care of the prescription parts and get the reimbursement for vaccination. So the first time the service, and that was roughly around 2012, so the first time the vaccination service was paid for the first time by some institutions, but not the patient itself. Then what happens is that health insurance companies realize also that it would be fruitful to have their own patients vaccinated. And what happened is that the prescription will still be needed. There will be a reimbursement for the National Health Service, but again, they would pay for the service. That was roughly around 2016. So as you can see, we had a big time lapse between these changes on reimbursement. And then 2 years ago, there was a big shift, actually 3 years ago, prior to COVID. For the first time, the National Health Service itself decided to pay for the vaccination service within pharmacy premises. So what happens right now is that we have many different ways of having your vaccination being paid at the pharmacy. And what I can also say to you from my own experience as community pharmacist is that it's variable, the amount of people that decide to pay for their own money, or if they want to go for health insurance, or if they want to wait if they are eligible for being paid for the National Health Service. So what we can see throughout time is that when your service is being recognized, you find other ways of reimbursement or reimbursing that service. That comes to actually nowadays, and that we'll see that on our next slide. We'll see, well, this is some breaking news, not that breaking news from many countries, but in Portugal, although we were very advanced, we're the first country in Europe to actually start administering vaccines in pharmacy. We didn't vaccinate for COVID during the pandemic. Anyway, we're still negotiating, and we have, well, almost at the end of the negotiations. I'm also part of the committee who's negotiated that on behalf of the society. But what we see right now is that for the first time, we have a single vaccine and vaccination being totally reimbursed to pharmacies to actually provide that service to the patients. So we came from the time that there was always the reimbursement of the part of vaccine to the time that we have vaccine totally reimbursed as well as a service. And of course, this pack is very important because from the sustainability point of view, the financial sustainability point of view is very important. But what we're also negotiating right now is access to the e-vaccination records, meaning that since we have more and more people being vaccinated in pharmacies, we need to have access to the records. And that's actually being negotiated, and it's part of the pack that's going to be available hopefully in September this year. If you move forward to the next slide, what we'll see is that we have here an overview of the amount of vaccines that are dispensed or supplied to pharmacies and the amount of vaccines that are administered in pharmacies. As you can see, throughout the last 3 years, and that's been steadily happening over the last 16 years, the percentage of people that prefer to pay for the service or have it done at the pharmacy is increasing. So last year, more than 63% of the patients decided to have the service being done in pharmacy, which is absolutely very good and very motivating to keep on doing our work. And then when you move to the next slide, you also see the other, or this part of other vaccines that are being administered. And you have here mentioned, this presentation will be shared to all of you to actually see what other vaccines are being administered in community pharmacies in Portugal. And then we come up to actually our last slide, in which you can see some opportunities and challenges of the service. And of course, that we are now for the first time providing a vaccine, as I mentioned, totally reimbursed by the national health systems. We plan probably in the next couple of years to have the vaccines that used to only have being administered in GP practices, public or National Health Service practices being administered in there, actually being administered in pharmacies. And of course, to increase the number of pharmacies who have the service, and to increase also the possibility of other pharmacies, namely working in retirement houses or in other essential areas, to also be able to do that vaccination to their patients. And of course, there's always, well, at least in a lot of places, we have some challenges with other healthcare professionals. What I can share with you as well is that nurses has been less and less resistance, because the facts are very obvious that pharmacists do help increase the rate of vaccination in populations. And of course, this is an endless job to keep on promoting, advocating within the government that we can do more. And now that we have more data, we can build actually on that to move forward with our practice. And that's all from my side. Thank you so much for your attention. I'm open to all the questions at the end of the rest of the presentations. Thank you.
Thank you so much, Luis, for that. An excellent example of how remuneration model is really a huge accelerator for pharmacy-based vaccination, and great news about pharmacists also delivering COVID-19 vaccines in the next flu season. We also have seen that in other countries where COVID-19 was somewhat of an enabler for at least continuing pharmacy-based vaccination, but sometimes expanding that. Thank you so much. And there's no country without its challenges. And I'm sure we'll see from the next presentations, but throughout the report, that a lot of these challenges are very common. And that's why we're here to learn from each other. Thank you again, Luis. Really, really excellent. I'm now very pleased to invite Faye joining us. Hi, Faye. I'll share your full and impressive bio, just like everyone else is in the chat, and giving you the floor now. Look forward to hearing.
Thank you, Lena, and also thank you, FIP, for the opportunity for the Pharmaceutical Society of Australia and myself to be here tonight. It's with great joy that I'm here tonight to talk to you all about what's happening in Australia, but also congratulations to FIP and the FIP leadership as well for the launch of this very useful toolkit. And very interesting presentation as well from you, Louise. I'm learning a lot even from your presentation, and a lot that I'll be able to apply back here in Australia. And I can't wait to meet you all in person, face to face, actually this year when you all come over to Australia for FIP Congress 2023. So before we start formalities, I do want to acknowledge the traditional custodians of the land that I'm dialing in from today. Today, I'm in the beautiful Sydney, and this is the land of the Gadigal people of the Eora Nation, and I pay my respects to the elders past, present, and emerging. So in Australia, pharmacist-led vaccinations have really come from a very long journey. But the brilliant news I do want to mention today is that we've hit the 11 million COVID-19 vaccine doses by pharmacists in Australia. And that is massive if you think about Australia having just over 25 million population, and pharmacists directly have provided 11 million COVID-19 vaccine doses. And that actually is not just proving how widely the community is accepting the role of pharmacists as a key vaccinator, but also showing the dedication and the passion and the commitment of pharmacists to actually deliver this very important primary care work. This slide here, I just wanted to share with you all to give an indication around using COVID as one of the example around COVID-19 vaccination, and just to see how COVID-19 vaccine provision has just increased over time, all the way from the sort of a few months into when COVID-19 vaccine was available until now. And the main thing here, the main message I really want to show here is to showcase how responsive and how agile the pharmacy profession has been in Australia, which I really think needs to be celebrated. Because you can see here at various different time points, whether it's the Moderna rollout, whether it's the winter dose, whether it's the various versions of the booster doses, you see how the uptake and the provision of vaccinations by pharmacists in Australia just continues to grow. And this really shows that pharmacists are contributing a lot to vaccination in Australia. And this slide here again, just to show how in Australia we continue to monitor different types of COVID-19 vaccine uptake, as well as the appetite of the consumers, and also the preferences in relation to different brands, but also in terms of their preferences in terms of the types of vaccines. But what we have found and what we have learned as well is that pharmacist education does play a big role in terms of helping patients to make that informed decision around their choice of medicine and their choice of vaccine. And of course, you know, government recommendations and local guidelines would play a huge role as well. In the next few slides, what I really wanted to show you here in the middle of this slide, you can see an Australian map. And in Australia, we have various states and territories. And the challenge that we have in Australia is that even though we are one country, but in the various states and territories, we're governed by our own jurisdictional legislation. And sometimes, or all the times, they're actually not always the same. So if I use, you know, prior to 2014 as an example, no pharmacist in Australia was providing or administering any vaccines at all. So it all started from 2014, when there was a pilot happening first in the eastern states in Queensland. So it started all with using vaccination as an example. You can see here very quickly, within a couple of years, because of the success of what we have seen with pharmacists providing influenza vaccine, you can see in the red boxes here, very quickly, pharmacist delivered vaccination has just got expanded to other types of vaccines and vaccine preventable diseases. And it includes diphtheria, tetanus, pertussis, like measles, mumps, rubella. And in most other jurisdictions, then they started to allow pharmacists, appropriately trained pharmacists, to provide influenza vaccines. Very I then fast forward into 2 years later, you can now see some of the jurisdictions are catching up on some of those additions, vaccines like DTPA and MMR. And then in 2019, there was a little bit of expansion. And fast forward, you can see March 2020 was already a few months into COVID-19 when we knew that access to primary care is a significant issue. And in Australia at that time, there was obviously a significant push around how can we strengthen primary care and how can we improve access to primary care. And if people can't get through to their doctors because doctors are very busy doing seeing many other consults, how can we as pharmacists contribute towards strengthening the entire healthcare system? And of course, vaccination then became something that was put on the table, on the agenda, and it's also something that the Pharmaceutical Society of Australia have been advocating for a long time. So then the question then went to, right, if pharmacists have been proven to be able to provide vaccines very safely and very effectively, why can't we apply this to other vaccines? Because pharmacists are medicine experts, and vaccines are a type of medicines if you think about how they're regulated and how they're used. And pharmacists absolutely have the knowledge around vaccines. And pharmacists know how to undertake professional development if they feel like they have any knowledge gaps that needs to be addressed. So why can't we apply these skill sets that we know pharmacists have and that we know pharmacists can do it well, can do it safely and effectively, and that we know consumers can have access? So therefore, you can see here on the top right-hand corner, there was that immediate, very quick expansion to a whole other range of new vaccines that pharmacists were first able to provide. But that's only in the one jurisdiction. And that was conditions like cholera, hepatitis A, for example, pneumococcal, meningococcal, ACWI, and so on. And that was only a few months into COVID-19. And then you can see, starting from March 2021, various different jurisdictions then started to allow pharmacists to provide COVID-19 vaccines. Again, some other states then caught up in a few months' time. Now, but then if you then look at a few months later after that, in May 2022, you then can see some other states starting to catch up. And a very good example down on the bottom, you can see that was Japanese encephalitis, because there was that immediate identification of a need to address that in that particular jurisdiction. But the lesson that we've learned there as well is that because the profession is so adaptable and so agile, and that we know that pharmacists can be used as a workforce in emergency situations when the health system requires a rapid rise in a particular vaccination uptake of vaccination rates, then pharmacists is an existing workforce to deliver on that. And that was one of the main reasons. And on this slide here, you can see this was the latest change was May this year. And you can see this is a very quick summary of all the different types of vaccines that appropriately trained pharmacists are able to provide. And you can see what a huge journey, a significant journey Australian pharmacists have actually come through compared to back in 2014 and now. And the latest news as well, in May this year, was the Australian federal government announcing that with the intention, starting from the 1st of January next year, to allow all pharmacists across Australia to provide vaccinations under the National Immunisation Program for people 5 years and above. And that is a significant move towards acknowledging pharmacists as a key immunisation workforce, and also acknowledging that the community widely accepts this as a key role of pharmacists moving forward. So, as Catherine mentioned earlier, in one of the series in this FIP webinar, we looked at vaccine regulation. And this is to demonstrate that, if we regard vaccine as a type of medicine, and in many of these countries, we do have system, and particularly in Australia, for example, we do have a robust system in place to regulate medicine and to regulate vaccine. Pharmacists, we know pharmacists are a rule stickler, and pharmacists are very, very good at, following protocols to ensure safety and efficacy of the service that they provide. And following all of this robust regulation and processes in place, it does help us. It does provide that safeguard and that confidence that pharmacists can continue to do this service and to do it well. And very lastly, what I do want to touch on here is this particular figure that was extracted from our Pharmaceutical Society of Australia's guidelines for pharmacists administering medicines by injection. You can see here, often in the advocacy work that we do, if we want to decide on whether we advocate for pharmacists to be able to do a particular activity, we will go back to looking at asking ourselves, is this within the scope of practice of a pharmacist? But what determines scope of practice? For something to be deemed as within the scope of practice of a pharmacist, we need to meet 3 categories. You can see 3 different colors on the bottom here. In green, we need to have competence to be able to do that. And that means the knowledge, and we have to have the skills to do that. Secondly, we need to have accountability. And what does that mean? It means that we need to have a robust standards and guidelines and frameworks and practice tools underpinning the work that we do to ensure what we do can continue to have quality and standard. And the third is we need to have authority. And that goes back to what we're allowed to do legally depending on where we're practicing. So I do encourage listeners tonight, if you're thinking about if this is something that you could implement in your jurisdiction, in your country, if you come from you work for an organization and you're thinking about advocacy work, this is something that you may wish to take into consideration is, if there was a particular area that was in the process of achieving, then that might be where you could put your focus on, so that we can move towards acknowledging that as part of pharmacy scope of practice. And just lastly, I want to leave all the audience with this sentence here. Pharmacists, really what we've learned in Australia is that pharmacists, we are the solution to sustainable and accessible vaccine and also injectable medicine delivery. And I want to take this opportunity to challenge the listeners here today on this webinar to think about eventually, if it is that we have proven to the world that pharmacists can administer vaccines safely and effectively, and if it is that we need to improve the sustainability and capacity of our health system, why can't pharmacists go on and provide or administer injectable medicines? There are a whole range of examples there that I wouldn't need to go into detail because you know what I'm talking about. And that's just something that I do want to park here and hopefully trigger some thinking moving forward. So thank you very much for your time. And I look forward to hopefully seeing you all in the beautiful Brisbane in Australia later this year at the FIP Congress.
Thank you so much, Faye, for that really excellent overview. I particularly really like that framework of the 3 things: competence, accountability, authority. We always think of competence and authority. Obviously, these were the topics of the program, but accountability is another important aspect of service expansion. And we love this sentence. We love anything that says sustainability, accessibility. And I know that this all will lead to reduced inequities across the profession. And I think that leaving us with the challenge of considering how we can build on vaccine delivery to expand into injectable medicines, I think is a really visionary question and is a problem for the future. But I think not a very big problem. We've proven ourselves for sure. So thank you so much, Faye, for this really inspiring presentation. Without further ado, I'd like to introduce Luna Bizri from Lebanon. She's the coordinating consultant at the Lebanese Order of Pharmacists in Lebanon, and she is also a community pharmacist. She wears these 2 hats for sure. Without further ado, we'll be playing the presentation from Luna, who isn't with us today, but was kind enough to send in a recorded video. Thank you so much in advance, Luna.
Good morning, good evening, good afternoon. Today, we're going to discuss the case of immunization in Lebanon and what's going on. But before starting, I wanted to start with something that happened very recently in October 2022, which is the cholera outbreak. Why? Because I have to say that the Ministry of Public Health is very fast and has a very fast response towards crises and catastrophes and disasters and pandemic. In fact, we have an excellent surveillance program And we have very early detected the 2 cases of the Syrian that have crossed the Syrian borders. And we have a very fast outbreak investigations. Very rapidly, there was development of cholera preparedness and response strategic plan and operational plan. And a list of series of effective measures to contain the disease and breaking the chain of infection at different levels were done. Number 1, training the healthcare workers. Number 2, educating and raising awareness of the community. And number 3, conducting a wide vaccination campaign. I should note that during this campaign, the healthcare workers were going from one school to another, and even in the areas where the government, the governance, or the areas where the cholera cases were there, we had the healthcare workers were going from one door to another door. So it was a very successful and very wide vaccination campaign. And I'm very pleased to tell you that in 11/6/2023, the ministry declared the end of cholera outbreak in Lebanon. And I have to note that this declaration has been done after 12 weeks of 0 new cases. Why I started by this? Because I wanted to tell you that Lebanon is very well known about the fast action and response during crisis. But how about the preparedness? Where do we stand? We're going to see. Recently, in March 2023, the ministry launched what we call the Lebanon National Health Strategy, the Vision 2030. And of course, the immunization calendar was there. But what is the vision of the ministry 2030? We can see that in the middle, we have the primary healthcare system centers, a network that is accredited and guided by the Ministry of Public Health, will be considered and is going to be considered at the major sites of the national calendar of the vaccination. Now, the pediatric population from 0 to 8 years old is the target. And these population are having their vaccine in these primary healthcare centers free of charge. What about the adult population? Well, there is no delivery vaccines in the primary healthcare centers for the adult population. If, for instance, I go there, I cannot find my vaccination, even if I wanted to buy it. And for the flu vaccines, they have to be purchased, and even in these primary healthcare centers. So as you can see, the primary healthcare centers network is the core of the strategy to enhance the vaccine delivery. Number 2, the target now, and for the short term at least, is the children from 0 to 18 years old. So if we go more details, as we have said, we want to strengthen the ministry wants to strengthen the National Primary Healthcare Centers network. And the aim, considering the vaccine delivery, is to reach all children in Lebanon with essential routine vaccines in line with this national immunization calendar. So what has happened recently? In 2022, we had a 22% increase in vaccine delivery, especially if we compare it with the previous years where we had the pandemic, because in these years of pandemic, we had a drop in the vaccine deliveries. We have also something around 200,000 children were vaccinated in these primary healthcare centers from the Lebanese and non-Lebanese population. And recently, in March 2020 or May 2020, April 2023, the ministry has launched what we call the solarization of the primary healthcare centers. And what does that mean? It means that these centers will have their electricity not depending on the government, not depending on the Ministry of Electricity. They will have their electricity fully from the solar energy. And why? What is the aim? Well, to assure the sustainability of the vaccination delivery by creating a functional and reliable cold chain. And I'm using the words of His Excellency, the Minister of Public Health. He is stating today's investment, he means about the solar energy, will improve essential health services for children. So till now, we don't see any place for the adult immunization calendar, the routine calendar. Let's see what is happening in the 2030 vision. So the National Health Strategy is stating we have to strengthen routine vaccination and adult vaccination. And they mention the yellow fever for travelers, meningitis vaccine for pilgrims, hepatitis B for healthcare workers, anti-rabies and COVID-19 vaccines, because, of course, we were at the end of the pandemic. But let's go more into details about the routine calendar for adults. Influenza and pneumococcal conjugated vaccines for high-risk groups, not a routine for all adults. Let's see what does that mean. A very recent study conducted has shown something very important about the burden of pneumococcal diseases among adults in Lebanon. Well, 40% of patients that have a community-acquired pneumonia are hospitalized. And 15% of the patients that are already hospitalized will catch a hospital-acquired pneumonia. And 7.5% of the total admission in the hospital are due to pneumococcal pneumonia. So you can see how is the impact on health and mortality on morbidity about the pneumococcal pneumonia, about pneumonia and pneumococcal diseases. How about the economic burden and impact? And what is happening? Of course, since we have said that adults calendar is not supported, at least in the present, by the government, guidance is absent, and private practices and community pharmacies offer the pneumococcal vaccine for adults as per international guidelines. But what about the prices of these vaccines? A quick look will show you that the PCV13 public price is $80, and the conjugated one, the PPSV23, is $40. What is going on? Are we going to have this vaccine? Are Lebanese adults will be able to buy this vaccine? If you know that the GDP in billion US dollars has fallen from 2019 from 15.6, and I should note that in October 2019, the economic crisis has begun, to 23.13 in 2021, and I can assure you it is lesser and lesser in 2023. If you know that 52.4% of the health expenditure comes from private voluntary schemes and out of pocket, and if you note that 80% of the population in Lebanon is poor, you will understand that many or most of the adults in Lebanon cannot afford to buy the routine vaccine in the calendar. And this is also another problem to look at. What about the flu vaccine, which is an important yearly vaccine in the routine calendar, especially in the adults, not only in the children? Also, another new study has shown that the most common vaccine received during adult life is the flu vaccine. 40% of these almost 1,000 subjects who responded to this survey showed that in their adult life, mostly they took the flu vaccine and nothing else from the routine calendar for adults. And something around 27, 28%, they thought that it is not indicated and they were unaware that they needed vaccine. So there's a lack of education and knowledge. And we have to note something about the vaccine hesitancy, because also around 28% were concerned about the vaccine side effects. And this will tell you something very important, that we should educate, we should enlighten and stand against the vaccine hesitancy in adults population. And here comes the role of the pharmacists, in particular the community pharmacists. What does the law say? The law stated that pharmacists in Lebanon are not authorized by law to administer vaccines. Their role is only to dispense vaccine received from pharmaceutical companies. But when you dispense vaccine, it means that you have to put vaccine in your pharmacy. So pharmacists will be involved in ensuring the safe supply and dispensing of vaccine. So they have to have a good knowledge of the cold chain supply handling and vaccination guidelines. It is very important that pharmacists are well trained for that. They have to manage vaccination records and to have some specification on premises and equipment. Also, as we have seen previously, they have to play a very important role as educators, in particularly in Lebanon, because they have to tell the parents on how to handle vaccine till they arrive to the pediatrician, and to educate adult patients about the vaccine, the routine vaccine calendar. I love always to finish my presentations when I'm talking about the vaccine deliveries in Lebanon with this slide. Why? Because in the context, the Lebanese context, it's very important to establish strategies that are low cost and attractive to all stakeholders. And pharmacists is the best solution for this, because the pharmacists in Lebanon, particularly the community pharmacists, are available all the time. And they are easy to reach. And until now, they are not remunerated for their services. So if you want to start, let's start bite by bite. Let's start to legally authorize administrations of vaccine against influenza, and then to move forward to reach the other list of routine calendar. We have to integrate community pharmacies and pharmacists in the national vaccination policies. And we have to be also integrated, because till now, unfortunately, we are not, in the awareness activities and campaigns conducted with the Ministry of Public Health and Lebanese Order of Pharmacists. We should be a very important part of the surveillance team, at least when we are reporting adverse events. Maybe we will be trained to report outbreaks and to know the cases. And finally, we can start to have a health record, at least to know to include the pharmacists and to have access to patient vaccination records. By this, I thank you, and I wish you a good day.
I wish to thank Luna on behalf of FIP for that. A stark contrast in Lebanon to the countries we've heard of before, where their main challenge is still in the regulation, and they're starting there. So thank you so much, Luna. I'd like to welcome Sarah Sorum, Executive Vice President and CEO of the Pharmacy Society of Wisconsin, where we'll hear about some of the issues, challenges, and hopefully positive enablers in the US. Sarah, welcome. Thank you so much. The floor is yours.
Thank you so much. It's a pleasure to be with people today. I think some of the points that other speakers have made have really emphasized our experience in the US as well around enablers and barriers. we saw with the COVID-19 vaccination experience and continue to see that a vast majority of the vaccination is done in pharmacies. In the US, 90% of people live within 5 miles of a pharmacy. So the access points are much more prevalent in pharmacies than they are in other areas of healthcare. So we're really seeing this rapid adoption. In fact, even from between the last presentation that we did as part of this series to now, a further expansion of enablers of vaccination in the US. And I will also mention that not only are pharmacists vaccinating in the US, but now we're seeing momentum, including in my state of Wisconsin, where pharmacy technicians, the assistants in pharmacies, are also providing immunizations after participating in training programs. Next slide, please. So the focus that I have on my few slides are enablers and barriers around information technology. And in the US, the authority is at the state level. It's different in each state. So there's nuances across each state line. And in addition to that, there's information systems, the technology systems that share information about vaccination records are different in each state. So each state has a separate immunization information system. So as we've looked at this, we definitely know that there is barriers around the access to these IIS or information systems. In cases where pharmacy staff are required to manually enter an immunization record, it leads to delays in that entry being updated, an increased risk of error for that information, so relying on the accuracy of it. And really takes a lot of time. And when we see a huge uptake in vaccination in pharmacy locations, timeliness and being able to leverage staff where they're needed in the clinical services versus the record keeping services is really important. Next slide, please. So we in Wisconsin had looked at a number of enablers around the information system entry, and timeliness again was facilitated by automatic entry into an information system. So when the formats can be leveraged to allow for automatic submission into an IAS system, there's more accuracy and more timeliness. We do have a requirement in Wisconsin that every vaccine is entered within 7 days of administration so that all members of the healthcare team can access that. But that is a requirement that's unique to pharmacists. So we don't have that same requirement for physicians, nurses, public health, and we really feel that the accuracy of the immunization record in the whole immunization neighborhood relies on all team members to participate in timely reporting. Next slide. So not only is vaccine reporting important, but also information systems can be relied upon for understanding which patients are due for which vaccination. So, it's important to leverage technology where we can to say, here's the vaccines that patients are in need of. We've really seen in the US with the COVID pandemic that, while there has been a lot of vaccinations administered for COVID, we've seen a huge decrease in the number of vaccinations across the life course that have been administered, particularly in children. We're down like 40% of vaccinations. So and then in adults, we are down by 100 million fewer doses of adult vaccines are given from where we expect that we would be. So the switch to virtual visits, the changes that people have made in terms of how they access the healthcare system have really left a gap in routine preventative care. And so it's really important that pharmacists play a role, pharmacy technicians, pharmacists, pharmacy teams play a role in filling that gap. So an information system can provide the pharmacist with information about which vaccines the patient is due for. So incorporating that into their routine workflow in a pharmacy is critical. And we're seeing most of the information systems are not capable currently of providing that real-time information to pharmacists as they're filling prescriptions or as the patient's coming in for another type of vaccination. Next slide. So I also wanted to just circle back to the remuneration discussion earlier. We certainly find that to be a barrier or an enabler in the US. And so when policies, when insurance coverage allows for broader access sites for vaccination, more patients receive vaccination. We have a program in the US that is called the Vaccines for Children program. It's hard for pharmacists to participate in that program. In some states, they aren't allowed to participate. In others, there's barriers and requirements that make it hard to maintain inventories, et cetera, that are required for that Vaccines for Children program. And in those cases, you're missing out on a huge amount of vaccination that could be done in that life course in the early ages, 18 and under. So we know that this is a place where, from a organization standpoint, we can advocate for better coverage, broader access to vaccination through remuneration. And then lastly, I'll just mention that I think the reason we find the vaccination conversation critical for pharmacist practice is not only because it's a top public health investment and effort, but it also opens the door for pharmacists filling other public health gaps. So whether that is opioid use disorder or healthy lifestyle management or chronic disease management, by working with public health, working with collaborators and partners in the immunization space, it opens the door for other conversations to help fill public health gaps. Thank you.
Thank you so much, Sarah, for that. A different set of issues and challenges, mainly focused on access to data, but the barriers, again, at the end, you summarized, are very much the same. Thank you so much, Sarah. I'm just going to very quickly run through a few tables, but these are in the toolkit, so I don't want to spend too much time on that. But what we've done is, as I mentioned earlier, analyzed a lot of the data from the country case studies we've collected over the past year to come up with a set of common enablers and barriers across each of the three areas: regulations, remuneration, and data access. So if we go to the next slide, just gives an overview of remuneration, enablers and barriers, some of which we've heard very much in the examples today. For example, one of the enablers for remuneration is developing an electronic registry for immunization to help monitor the impact of pharmacy-based vaccination. Another one is incorporating vaccination education and training into pharmacy curricula, advocacy, etc. And some of the common barriers include, obviously, the most obvious one is the absence of active remuneration schemes, disregarding the additional charges associated with vaccine administration, and lack of training and education, and competition and resistance from other healthcare providers, which we know is also very common. The next table or map of enablers and barriers relate to regulations and prescribing. So some enablers, I'm just going to pick a couple here, include leveraging the public's acceptance of pharmacy-based vaccination that would enable regulatory change, enhancing pharmacy curricula, again, so we can see education and training being a recurring theme, granting pharmacists access to data. So the three issues sort of can enable or challenge each other. So there is an intersection between the three areas we're actually looking into. Some of the barriers include ambiguity of pharmacist roles in prescribing and administrative roles, lack of recognition, lack of uniformity in laws, documentation again, communication, and once again, limited education and training on services. Last but not least, in terms of another map for patient data and vaccination records, some enablers include collaborating, communicating effectively with health authorities. Learning from other countries' experiences implementing similar systems has been identified as an enabler as well. We can also see surveys to gather feedback on contribution of pharmacists, and the ability to adapt digital transformation and provide more digital health services is another enabler. In terms of barriers, we've identified a few, such as lack of effective communication between stakeholders. Training of pharmacists on immunization record keeping is important, and limited access to complete records for comprehensive consultations. This is more of a nationwide issue addressing patient records. So you may find a list of these in the policy toolkit, preceded by a full deep dive into the country case studies. Moving on, and I've just reminding everyone of the link to the toolkit I've added in the chat. I'll add that again for easy reference. I'd like to welcome Dr. Daphne Holt, now Chair of the Coalition for Life Course Immunization, who's going to talk to us about life course immunization and the pharmacist. Dr. Holt, thank you so much.
Thank you. And I'd like to thank FIP for inviting CLCI to participate in this important dialogue. We are a European organisation, so you'll note that my remarks are pointed towards Europe. So I hope that those people who are not from Europe who are listening will forgive me for that. Next slide, please. So I've been asked to cover 4 points: the importance of life course immunisation, the role of the pharmacist, reflections on the toolkit, and recommendations. But before that, I'd just like to say a few words about the Coalition of Life Course Immunisation. Next slide, please. So, who are the Coalition for Life Course Immunisation? We are a diverse network of expert individuals and associations from across Europe. We're registered in Brussels and in the UK, and we have 24 members in 13 countries. And we're committed to preventing infectious diseases by highlighting the benefits of vaccination throughout their life course. But the important thing, and this has already been said, I think today, is that we change the paradigm from vaccines are just for children to vaccines are for everyone at all ages and stages. Next slide, please. So let's go back to the agenda. Why is life course immunisation important? Well, the first point, and as I say, I'm speaking about Europe here. The first point is that Europe is aging. Almost 1/3 of the population is over 55 years of age, and within the next 3 decades, it will be over 40%. Europe is not equitable. Although the COVID-19 vaccination was available in all European countries at no cost for residents, some countries lag behind in vaccination rates. For example, and this is just an example, all former communist countries from Central and Eastern Europe exerted lower vaccination rates than Western European countries. And indeed, they occupied the last 10 positions in terms of vaccination rates for all ages in Europe, according to the ECDC vaccine tracker. And outside of COVID, we know that European countries diverge on policy and data. So different vaccine recommendations and different methodologies in data collection make it harder to monitor uptake. And I think I've already heard that from other people in this seminar. Next slide, please. So, and I've also heard this very loud and clear from what has been said already. Pharmacists are very important in the life course immunisation dialogue. Community pharmacists are the 3rd largest group of healthcare professionals in the EU after physicians and nurses. That means that they are accessible, and most Europeans have I believe, easy access to a community pharmacy. That means that they are trusted in the same way as physicians and nurses. This is a really important point, actually, because when one considers that most citizens who receive vaccinations are not sick and therefore are less likely to encounter traditional deliverers of vaccines. They're knowledgeable. Their years of training ensure this. We've also heard that mentioned. And so they're ideally placed not only to deliver vaccines, but to improve health literacy also. And I can hear people already howling at the screen about this. They're perhaps time rich, and I add the exclamation mark there, or at least they have perhaps more time to listen and advise than one gets in the usual 10-minute appointment with a general practitioner. Next slide, please. So let's reflect on the toolkit. It contains a wealth of information, that's very sure. It's a comprehensive coverage of FIP work in the life course immunisation space. The case studies are super informative, but the point that struck me was that they're so from different countries with such different cultures, and therefore maybe the approach is different in different countries. And we've also heard a lot about that at the minute. The policy enablers are without doubt the right ones. Certainly all of these issues should be addressed by policymakers, not just in Europe, but across the globe, according to what I've heard thus far. But my train of thought went to who exactly is the audience for this toolkit? Is it individual community and hospital pharmacists? Is it in-country national organizations of pharmacists? Or is it the politicians who can make these things happen? I think my personal opinion, as always, is that there are times when we have to get political about these things. Next slide, please. I actually hesitate to offer recommendations on what's a very nice piece of work. So these are just things that I've thought about as I was reading through the toolkit. And I've already mentioned many of these, and they have been mentioned by quite a lot of people already in this seminar. So this really acts as a summary. Without doubt, it's important that pharmacies are engaged in vaccinating citizens. I don't think that we can dismiss that at all. That is absolutely what we need to do. And pharmacists work in many locations, so they are ideally placed for this. I've got this vision, and maybe it doesn't apply everywhere, but with the correct authorization and empowerment, just as in some countries where nurses vaccinate children in schools, pharmacists should be able to vaccinate adults, not just in pharmacies, but in the workplace and in leisure facilities, so such as the gym. You go to the gym, you go for a workout, you get vaccinated. It's easy. I've already mentioned about defining the audience. And in my view, there's a huge potential in giving citizens the tools to enable them to speak directly to the policymakers. I've already touched on that. However, as I've already mentioned, countries and cultures across Europe, without considering the rest of the world, and as I pointed out in the first instance, I direct my remarks towards Europe, it's so different, and maybe this needs to be considered so that we have the right messages delivered by the right messengers on the right platforms, and that is really the important thing. Defining the audience, as I said, it's more segmented, I think, than we really realise. And finally, the word toolkit implies implementation. So if one gives a mechanic in a garage a toolkit, one expects that its contents will be used to repair the car. And the measure of success is that car can be driven away. So I ask, therefore, if we are offering or if a toolkit is being offered, how can we measure the success of that toolkit? Next slide, and this is the last one. Thank you for your attention. I do hope this has been useful.
Thank you very much, Daphne, for your thoughts and reflections from a bigger point of view across all of life course and the approach to life course in health. Really appreciating that, and leaving us with these questions at the end. And I think you're right. Toolkit implies implementation, and we have developed this to support members specifically to transform policy. So follow up to uptake is the next step, the natural next step. I'm going to now that we are nearing the end of our webinar with 5 minutes to go, I'm going to invite our CEO, Catherine. Catherine, thank you so much for your support throughout the whole program, of course, as our CEO. We'd love to hear your reflections on everything you've heard, but maybe with some focus on how this is a priority for FIP continuing to the future. Thank you, Catherine.
So, Lena, it's just a great honour and pleasure to be listening to not only the experiences, but the constructive reflections on barriers and enablers and the stories of success. And honestly, the stories where things perhaps haven't worked quite so well. I think, Daphne, you raise a really, really good point about a toolkit is only as successful as its implementation. So we will be monitoring that. We've got a big set of programs going on around surveillance, and then around the case studies, and then obviously enablement from our side as well. That's one thing I wanted to mention. A second point that I've been looking at in the question and answer box is around how, and it fits into Daphne's point about the politics of all of this. And politics may not only be with politicians and national governments and health ministers, and indeed finance ministers, but can also be with other professions. So I think at FIP we have many examples of countries where perhaps nurses and or doctors have got grave reservations about pharmacists engaging in vaccination, which we can showcase and share. From a global perspective, we can work through our colleagues in the World Health Professions Alliance to make sure they're lobbying on behalf of pharmacy from other countries. It's often about sharing examples where the tribal or the turf wars just don't exist, that pharmacists aren't going to be going after the patients that other professions have in their care, very often different populations. So I think this is something we can actively do. And I think my final point in rounding up, and I wonder if there's any other questions, Lena, that we could just draw on for the last minute or so. But I think the other piece here is for the sustainability of services. We really need to tackle how these are remunerated and how we can ensure equitable access. So I think the issue of remuneration is one that is firmly and squarely on the table. And again, I think this comes to the points about having evidence of impact, having evidence of good quality services. And I really love the idea, Daphne, about not limiting ourselves to four walls in communities, but also going where the vaccinations can be best delivered. My final reflection on all of this work is that the vaccination piece has been growing over the last decade or so, and the pandemic really showcased for all of us the need for vaccines, the need for vaccination programs, and for pharmacists to build on what they've been doing previously, but also to accelerate that and learn from other countries. There's much in this toolkit and in the program of work, the programs of work that we've been undertaking in vaccination that can be applied elsewhere. FIP's vision, after all, is for a world where everyone has equitable access to safe and affordable medicines. And the vaccines piece just showcases to us there's more to be done. There's more to be done within nations, there's more to be done between nations, and there's more to learn from each other. It's been an absolute privilege and pleasure to listen today to the work on Showcase here. And I do know, Lena and Noor, that whilst we're launching this toolkit today for pharmacists and for pharmacy organisations, we will do much around our policy development. We're launching a policy statement on life course immunisation in our council meeting in Brisbane in September. There'll be much to do around the politics of this, the implementation of this, and the learning from all of these elements across all other medicines related services that pharmacists are able to deliver. There are barriers and enablers to all of that, but the driving force needs to be for the patients and the public we serve. And I think this toolkit really, really goes a far way to demonstrate that. Thanks so much, Lena. I think we've got 1 minute left. I'm not sure if we've got any more questions to answer, but I really think this was a delightful event. Thank you so much to you and Nor, and to Gonzo and to Ruben as well for pulling it all together. Great work.
Thank you so much, Catherine. Thanks for the engagement of our audience. I know there was lots of questions coming through the question box, but most of them have been answered on time. And this leaves us with much to explore in the future. And I know, Catherine, building on what you said, there are a lot of these enablers and barriers that we can dissect and understand better. They themselves have enablers and barriers, and we're here to support our members every step of the way. Before closing the session, we just want to remind you of in the next slide of our digital events. You will find a recording of this on events.fip.org, as well as all of our FIP digital events are published on there and free and accessible for all. You may find them as well on our FIP YouTube channel. And finally, next is a reminder, I believe, of our, it's not there, but we'd like to remind you of our Congress in Brisbane in September. If you aren't planning to attend already, please consider doing so. And if you are planning to go, we are very much looking forward to seeing you there. Thank you so much. Thank you, Noor. Thank you, everyone, for your support and contribution. We're wishing you a very, very good day. Bye for now. Thank you so much.
Thank you. See you.
Thank you.